There are also changes expected around who may be able to get a COVID vaccine shot this fall, after a CDC advisory panel no longer recommends it for most healthy children and adults. Jennifer Hoff joins us now with more on what happens next, specifically here in Minnesota. Jennifer?
Right. Julie, the agency's advisory committee on immunization practices announcing people can make their own decision on whether to get the shot, even limiting it to those 65 and older and with underlying health conditions. And that's where Minnesota comes in. The state now making a rare move to ensure anyone who wants the vaccine can still get it.
Minnesota's weather isn't the only thing that's about to change. People like Pam may no longer be eligible for a COVID-19 shot she already got this fall, after a Centers for Disease Control and Prevention advisory panel unanimously recommended vaccination be determined by individual decision making.
They criticize us very severely of saying that we are dangerous and unscientific, which is completely false. There's a lot of expertise on this committee.
The group also agreed the vaccine should be limited to people 65 and older or with underlying health conditions. That now has the state's Department of Health stepping away from federal vaccine recommendations and promoting medical associations instead, like the American Academy of Pediatrics.
I don't want to turn the clock backwards. We have made amazing advancements.
Dr. Ruth Linfield is the agency's medical director, also making a rare move, issuing an order giving pharmacists the option to provide vaccines to patients as young as 3, while recommending it for anyone over 6 months.
I think that what Minnesotans need to know is that there hasn't been any change in the safety of the vaccine that would warrant more caution. And we want to be sure that people have access to it.
Changes may be in store for some, but Pam says she'll stick to the same shot.
We believe that it's going to keep us healthy.
And here's something else on those pharmacists. Most times they can only give the COVID shots if they follow that CDC panel's guidelines. And sometimes they can face legal trouble if they don't. So this MDH order essentially protects them now. The full recommendation will become final if cleared by the CDC acting director, Julie, who has already praised them. So that is likely coming down the pipeline.
All right. Thank you, Jennifer.